If we were all to close our eyes and think of one of the most fun times we have spent and the most social and spontaneous times, most people might mention their adolescence. Free of stress, since most of our priorities were to go to school, get good grades, and at times work less than a part-time job in order to get some fun money in our hands. We think of parties or close friends, or even at times we think of simply the best times we could have ever spent. What we tend to forget is how much stress we were in when trying to accomplish all of these things. We had to stand out in some way in order to have colleges to fall in love with us and invite us in order to start the beginning of what we call our future. Did we take the right classes? Did I do enough work? And do my grades really show who I am? All of this, and our only outlet, is high school during these stressful times where social interactions and connections we made with people who are going through the most similar situations. Now roll back in your memory and try to think of these stresses of your life during your teenage years and try to imagine going through all this and having social connection and face-to-face interactions being taken away completely. Your only outlet being gone with no way of bringing it back. Because of this, we now have higher stress rates in teenagers, handfuls of mental health disorders due to isolation and limitations on outlets they would normally have access to under normal circumstances during their day-to-day learning lives, leaving them isolated and without any means to socialize outside their homes. According to the National Center of Education Statistics, this is what about 15.4 million American teenagers faced in the year 2020 when an unexpected pandemic hit and we were forced to give up interactions and quarantine for an unknown amount of time. What can we do to help, and how do we lessen the numbers of mentally ill and overwhelmed teenagers? We need to act and create an outlet in our new continuously changing world. In the next couple of minutes, I will explain the lasting effects on mental health in young ages, what affects adolescents the most, and what we are doing to help them, and what we could improve to ensure these types of issues don't cause a high suicidal rate in adolescence in the next couple of years that are to follow. So what are we going to do to help the future leaders of our world in ensuring they are able to handle and go along with changes that even us as adults can't handle? Well, the problem is we aren't really doing enough to help them in the way that they need to be helped. We continue school because we don't want to hold them back, give them regular access to technology for at-home studies, and we make sure they attend online school regularly to prevent any falling back. But the problem is that this isn't enough. As mentioned in studies from the World Health Organization, suicide is the third leading cause of death in people between the ages of 15 to 19. Depression is one of the leading causes of illnesses and disability among adolescents, and most mental health conditions start by the age of 14 and are not diagnosed until later in life. These children needed help before the pandemic, yet we didn't manage to find or maintain any solutions. The high stats rates on teens suicide from death and mental illnesses is our fault. These numbers show that we are struggling and children were dying because they needed help in managing situations that were stressful and in situations they felt they had lost control of their own life. Children are losing their battle, and we are at fault for the losses of children when we're supposed to help them and guide them through the journey to take over the world once we're gone. We have to act now, and we have to act strong. There are many problems and issues related to stress and anxiety in young adults because of the current situations. Problems can arise from one of these and become further and worsening mental health issues, which are shown in 2020 Mental Health America, directly related to the pandemic, which has shut down these kids' lives. They are now more vulnerable to problems such as substance abuse, major depressive episodes, and so many other problems. It's important to act strong because adolescents are now suffering in silence. The percentage of teens dying from mental illnesses are too high, especially when thinking of them being young kids taking advantage of their own lives. When thinking of these problems in younger people, we forget that they're affected by the day-to-day life and are going through this alone. If we thought this time in our lives was stressful, we should try and imagine how it is now with all the other changes that are occurring in today's world. My younger sister is now a senior in high school, and she was affected by this pandemic during her junior year. She missed out on all of her high school dances and missed out on sports and so many things that we look forward to as small rewards for getting us through these challenging and tough times. They missed out on everything we looked forward to, and are now facing 4 walls of whatever room they're forced to do schoolwork out of. My sister is struggling with so many issues that are surfacing from being stuck within her own 4 walls. Depression is there along with so many other things, and if she didn't have a family as supportive as us and a little bit of fresh air from walking the dogs, who knows if she would be part of this statistic too. As mentioned as well in the personal story of experiencing this firsthand, Megan explains her experience in the Stat News article with a teenager being left alone, which led to misuse of prescription drugs and began to self-harm and need medical help due to her stress, anxiety, and depression levels that were continuously rising. There are many things that we can do collectively to help children, especially in times when they feel even more alone and isolated. We need to help better prepare them for changes like these by talking to them and connecting to them as we would at college or at work. We need to ensure that when they get on this cliff of their life, which is a cliff that's understandable because we all go through it, that they're able to prepare themselves and face things and talk to people without hiding how they feel at the moment. By helping these younger students and adolescents, we are lowering the risk of self-harm, inflicting harm on others, and ensuring that they have a more stable future. How we do this could be something as simple as creating groups at school that can be more interactive at home and online, so that we can help our students get the best possible care and maintain a better check-in system that will allow them to be communicating within a confined adult. What they look for is outlets, and we need to provide those with people who are supposed to be caring for them. By getting group rates together, the rates will go lower, and we will lower the risk of suicides in teens, and we will lower the rates of stress-related mental illnesses. Creating more groups in schools that we can meet via Zoom or other types of video chat can help maintain their connections with others, as well as keep them connected to an adult that they can feel comfortable asking if they need help and they find themselves needing it. We need to look for these signs. These are telling signs that issues may be more worrisome and will require immediate help in order to possibly save someone's life. According to the CDC and the healthychildren.org, there are signs your adolescent may need you. These are include and not limited to changes in mood and loss in interest, socializing over the phone, and talking to others is a big sign that your child may need more help than you can provide. Connection is the most important word to learn today. They need connection to survive and to thrive in their world and ours. Connection is what separates us and makes us human. The more connection we have, the more likely we are to survive in a world like ours. Let's not limit it, and instead let's make sure we show more willingness to help and ensure the safety and well-being of our adolescents and our future.